Welcome back to Field Notes with Mike. This video is a short review of our lecture notes based on the Emergency Care 14th edition EMT textbook. I'm creating this to help myself solidify the material and to help other EMT B students prepare for the NREMT exam. We are going to go ahead and start with Chapter 1, Introduction to Emergency Medical Services. And it starts in 1790. In the 1790s, the French began to transport wounded soldiers away from the scene of battle for care by physicians. This was the earliest documented emergency medical services. Civil War brought Clara Barton, who began emergency service for wounded and later helped establish the American Red Cross. World War I brought the Volunteer Ambulance Corps, and the Korean and Vietnam Wars brought medical teams that produced advances in field care, and then battlefield advances led to civilian advances such as specialized emergency medical centers devoted to treatment of trauma. Non-military ambulance services began operating in the early 1900s in the United States. Transport services, only with little or no emergency care, did not develop into smaller communities until the late 1940s, operated by local undertakers or fire service, and they needed to organize systems for emergency pre-hospital care and train personnel recognized. Need to organize systems for emergency pre-hospital care and train personnel recognized. 1966, the Department of Transportation was charged with developing EMS standards. 1970, founding of the National Registry of EMTs, the NREMT. 1973, National Emergency Medical Service Systems Act was passed by Congress. Regulation and policy, there's going to be a good number of these that have to do with the NHTSA standards for EMS systems. The first is regulation and policy. Each state establishes laws, a lead EMS agency, a founding mechanism, policies, procedures, and regulations. I saw a question where it asked, are all the states in the United States, does EMS fall underneath one of them? And the answer is right here. It's each state establishes their own. Number 2 is resource management, centralized coordination of emergency treatment and transport resources. Number 3, human resources and training. Assure that EMS personnel are trained and certified to the minimum standards. Number 4, transportation. Provide safe, reliable transportation. Number 5, facilities. Transport to the closest appropriate facility. Number 6, setting up communications, which include the Universal System Access Number, 911, and for dispatch to ambulance, ambulance to ambulance, ambulance to hospital, and hospital to hospital communications. Number 7, public information and education. Educate public about their role in EMS, access to EMS, and prevent injury. Number 8, medical direction. Setting up a medical director who is accountable for EMS personnel within the system. Number 9, trauma systems. Develop trauma triage, transport, and treatment protocols. Evaluation being number 10. Establish a program for evaluating and improving effectiveness through QI, QA, and TQM. The components of the EMS system include emergency medical dispatchers, who are the activation of EMS in response to patient emergencies. EMS responders, being emergency medical responders and EMTs, as well as paramedics, but we're not in paramedic school, so I think that's why they left that out. And then emergency department hospital includes the nurses, doctors, and allied health personnel, being components of the EMS system. So the EMS system, you have the dispatchers, you have EMS responders, the EMTs, and then you have the emergency department and hospitals, being the doctors, nurses, and then other health personnel. The components of the EMS system also include the specialized care facilities such as trauma centers, burn centers, pediatric centers, cardiac centers, and stroke centers. Knowing whatever agency you work for, knowing what you have around you. Say if you have a burn victim, do you have a burn center in your city, or are they going to have to get transported to, say, Mobile or Atlanta? Are they going to have to be flown somewhere to, down here, there's a lot of diving that goes on. Where do we have a decompression chamber at? So I guess these specialized care facilities, last week in lecture, this was talked about a little bit. Accessing the EMS system through the 911 telephone access, it's available in most communities. And then also enhanced 911, which provides caller number and location for landline phones. Emergency medical dispatchers, EMDs, they can provide instructions to callers on how to provide emergency care until EMS personnel arrive. Research has consistently pointed to the importance of early access and prompt initiation of emergency care and CPR. These dispatchers are on the phone and they're walking through the steps on how to perform some of these things to people that really need the help until EMS can arrive. Critical decision making is a very important concept in EMS. By gathering information from the scene, patient assessment, and other sources, and interprets. Can I even talk today? Information to make decisions regarding treatment and transport options. When information is not enough, ask for more questions and perform additional examinations. Levels of EMS training. 4 general levels of EMS training and certification that may vary from place to place, city to city, state to state. You have emergency medical responder, EMR, emergency medical technician, EMT. In most areas, this is also the very minimum level of training for someone to work on an ambulance. And then you have an advanced emergency medical technician, AEMT, up here in Northwest Florida. I don't know too many AEMTs, but I do see a lot of EMS ambulances with a paramedic and an EMT. Although last week they had mentioned that some agencies are running ambulances with 2 EMTs, Bs, not Ps. So, and then you also have paramedic. Those are the 4 levels of EMS training. Roles and responsibilities of the EMT. Personal safety, safety of crew and patients and bystanders, working with the public safety professionals, patient assessment and care, lifting and moving, transport, transfer of care, and patient advocacy. The physical traits of a good EMT include ability to lift and carry equipment and patients up to 125 pounds, good eyesight for distance and reading, awareness of any problems with color vision, and then good communication skills, both oral and written. Personal traits continued of an EMT are being pleasant, sincere, cooperative, resourceful, being a self-starter, emotionally stable, able to lead, neat and clean, and of good moral character and respectful of others. Also in control of their own personal habits, controlled in conversation and able to communicate properly, able to listen to others, and non-judgmental and fair. Maintain their, education-wise, maintain up-to-date knowledge and skills through refresher courses, continuing education courses, conferences and seminars, and lectures. where you will become a provider. Where can you work once we get our NREMT? You could work for an ambulance service, a fire department, wilderness search and rescue teams, urban and industrial settings, and volunteering. Here in Pensacola, the paper mill sometimes looks for EMTs who are looking to get hired, and you kind of act as a medic and on-site medic for this industrial setting of a paper mill. I thought that was pretty neat. National Registry of EMTs, the registration for EMRs, EMTs, AEMTs, and paramedics who successfully complete NREMT examinations. The National Registry of Emergency Medical Technicians may also help in reciprocity, transferring from one state to another. And it also is beneficial when applying for employment by having this national registry. Quality improvement, an important concept in EMS to ensure that the public receives the highest quality of pre-hospital care. Continuous self-review with the purpose of identifying aspects of the system that require improvement and to develop plans to correct deficiencies and improve performance. And the quality improvement is also everyone in the organization has a role by preparing carefully written documentation, becoming involved in the quality process, obtaining feedback from patients and hospital staff, maintaining your equipment, and continuing your education. All underneath the medical direction, all patient care performed is under the direction of a medical director. That person is ultimately responsible for patient care, oversees training, develops treatment protocols, and issues offline medical direction, which are known as standing orders, and also provides online medical direction. The EMS role in public health includes injury prevention for geriatric patients, injury prevention for the youth, public vaccination programs, and disease surveillance. Research. There's two ways research affects EMS. One is focus on improving patient outcomes, and then the other is through evidence-based techniques. The evidence-based process it's done by forming a hypothesis, reviewing literature, evaluating the evidence, and adopting the practice if evidence supports it. The dynamic nature of treatment makes research difficult. Not all research is created equal, and it's best to embrace practices of conducting and embrace best practices of conducting and evaluating research. Rely on scientific method. General observations turn into hypotheses, and predictions tested to prove or disprove hypothesis. Types of medical research. You have peer-reviewed research and medical journals, and then you have articles in EMS magazines, which are good, but they're not original research and they're not peer-reviewed. Special issues. Through this course, since this is Chapter 1, we were told about local issues and administrative matters, course description, class meeting times, and requirements for the certification as an EMT. Know the Americans with Disability Act. Know that they have strict guidelines preserving the rights of Americans with disabilities. And then that pretty much covers Chapter 1 lecture notes. The next little part here is going to be a chapter review, just kind of reviewing all that. So we're going to jump right into it. The EMS system has been developed to provide pre-hospital as well as hospital emergency care. The EMS system includes 911 and other emergency access systems, dispatchers, EMTs, hospital emergency departments, physicians, nurses, physician assistants, and other health professionals. The EMT's responsibilities include safety, patient assessment and care, lifting, moving, transportating patients, transfer of care, and patient advocacy. An EMT must have certain personal and physical traits to ensure that the ability to do the job. Education includes refresher training and continuing education. Quality improvement procedures and medical direction are all essential to maintaining the highest standards of EMS care. Remember this, EMS dates back to the Napoleonic times. Modern EMS standards come from the 1960s and 1970s and the National Emergency Medical Service System Act. There is a chain of human resources involved in EMS. Critical decisions are made by each member of the chain. There are certain personnel and physical traits that help you be a successful EMS provider. And last but not least, an EMS provider should actively pursue opportunities to improve personal knowledge and abilities as well as the unit's overall quality. This was the short lecture notes. For each chapter, I'll be going over the lecture notes that are provided to us in class through a PowerPoint. And I hope that by listening and reading, this will all come together and that we all pass the NREMT and look back at this and just continue to move forward. Thanks for listening.